Almost on a daily basis, when I'm talking to a patient about their breast cancer in the right or left breast, I have to remind them that for the rest of their life, they are at risk for a brand new, unrelated cancer in the other breast. And that breast cancer follow-up is a lifelong experience. So it's not surprising that we might get questions coming to breast cancer answers about, oh gosh, now I've got a cancer on the other side. I'm not sure I can go through with it. The doctor making recommendations. So the bottom line becomes, how do I treat this new cancer in the other breast? And the answer is quite straightforward. You want to treat the new cancer in the other breast, meeting all of the contemporary standards of care that we know today that maybe were actually done for the cancer affecting your other side originally. So you've got to remember, if you've had cancer on one side, you can have cancer on the other side totally unrelated. Also, please remember that if you've had any kind of cancer, no matter what, uterine cancer or thyroid cancer or whatever, you have an increased risk of a cancer that's different from whatever you've had originally. We don't know why yet, but no matter what, if you've had a cancer, then for the rest of your life, you're at an increased risk for other cancers. Now, what's really critical here? Really critical here is maximizing the state of the art as we know it today. And if that means radiation therapy as an example, even if you had it on the other side, if it means going through chemotherapy again, if it means going through more in the way of anti-hormonal therapy, we have got to do these things. Because remember, when you have an invasive cancer, you've been shedding off cancer cells that potentially are circulating around your body, may sit even dormant in other parts of your body. And so if indicated, we want to go after those circulating tumor cells with chemotherapy. We want to go after them to turn them off with anti-hormonal therapy. So as I've said frequently, work with a multidisciplinary team. Please listen to your doctors. No matter how heart healthy you are, which is great, you still need what we've got to offer you as the contemporary standard of care as we understand it today, in order to get you a long ways down the road. And so that if your cancer should ever come back down the road, we're going to have new and other things hopefully to use at that time. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.